Good morning. This is David Dillard from the Sleep and Sinus Centers, and let me adjust this. The I thought we'd talk a little bit today about sinuplasty and some of the things that we see with sinuplasty, and some of the typical things that I think are commonly told to patients about what causes people to feel like they're breathing or not feel like they're breathing. And some of the things that we've observed since we've started doing the minimally invasive sinus surgery. So, for those of you who are not familiar with either sinuplasty or balloon sinus dilation, sinuplasty and balloon sinus dilation are both names for a technique where we can go in and open the opening to the sinuses without actually doing quote unquote real surgery, meaning that we're not actually cutting you. It is much more simple on both the patient, the recovery is much easier, and it is much simpler to take care of post-operatively. So it is appealing for a number of reasons, one of which is that it's safer. So if you're having chronic sinus problems, which are incidentally very difficult to separate out from other conditions like allergies and migraines at times, because the symptoms can be similar, and the only real way to know that you have sinus inflammation is with imaging. You can't tell completely by doing scopes, using small lights to look in the nose. Doesn't really give you a perfect view of the sinuses, and there's no perfect tool, but one of the best tools for managing this is the imaging technology like CT scans to help us look at that scenario. But the sinuses, if they are truly inflamed, are like pockets on either side of a hallway where you've got a door closed, and the idea being that if you open the door, you can help it to drain. Surgery does not solve the inflammatory conditions that got you there, but if you don't take care of getting the sinus opened, fixing the inflammatory condition is not going to fix everything either, because now you've got basically a pocket of pus that needs to be drained. So the sinuses, which are like a series of steam rooms down in the hallway, and the hallway is like the center of the nose, the sinuses are on either side, can be opened with a small balloon to inflate it, dilate it, and then you of course remove the balloon so nothing stays inside of you. Now, the nice thing about this type of technique is that it is done through the nose. It can be done actually in the office, either with or without sedation. It can be done under local anesthesia, and that's a bonus. But the things that you'll see when you do these a lot are that people will wake up, and if you don't do anything else but just the balloon, they will tell you that they can breathe better afterwards. Now, having observed that a number of times, and recognizing that we haven't really done the traditional things that we thought about that were done to open the nose, such as turbinate reductions and septoplasties, it sort of changed my way of thinking about what constitutes your sensation of breathing. And probably a very large part of it that's gone unrecognized is the opening to the sinuses plays a big role in whether you feel like you can breathe or not. So if you have had someone look in your nose that hasn't really discovered the reason for your stuffiness, and you've tried stuff to keep it moist to try and make sure it's not just too dry, um, you probably should consider having someone investigate what was necessary to get a CT scan and look inside the sinuses, because a lot of times either turbinate reductions or septoplasties may not be successful in making you feel like you can breathe if you have sinus infections. And sinus infections are sometimes subtle. People uh, half the time don't know that they have them. If you take a large group of people who have sinus imaging on CAT scans or quote unquote X-rays that are done for other reasons like headaches or whatever, and the scans show up sinus infections, half the time people are not even aware that they've got the sinus infection. Of course, half the time they are aware of it, but what it tells you is that oftentimes you can have these infections that you just think of as being normal, and you don't get it treated. So if you're not breathing well, um, this is one of the lessons that we've learned from the sinus dilation or slash sinuplasty um, technology, and you should have that investigated. So, take home message: if you are feeling like you can't breathe, um, the minor sinuplasty procedure may be something that you need to consider looking into if you have a history of sinus problems before you have any other surgery, because it is easier to deal with. And then if you've had a septoplasty or you've been evaluated and you have septal deviation, and you've been chronically stuffy and it hasn't been since they were like 12, it's sometimes useful to get an x-ray before the surgery just to exclude that possibility that you might have an additional problem that could fix it without the more invasive septoplasty. Hope this has helped, and we'll talk to you soon.